Thank you, everybody, for joining us this morning. I'm excited to talk with our guest, Morgan Cowie, today. And Morgan, one thing that we like to ask all of our guests is to just start out by telling us about your own career path. So, how did you become interested in this field? And then, how did you end up in the position that you're in today?
Yeah, okay. So, hi guys, I'm Morgan. Right now, I am the clinical coordinator for the radiation therapy program at Bellin College, and I'm also a licensed radiation therapist. I kind of took a different route than most therapists take. First, I got my bachelor's in biological sciences pre-medical, and then decided after that that I did not want to go to med school. And then also I had a family member go through treatment, and she talked a lot about the therapists and the impact they had on her in her course of treatment. So that is what led me to this path. So I ended up going to Northwestern Memorial in Chicago, and it was an accelerated program, so it was about 16 months. And then after that, I took my boards, passed my boards, and worked as a radiation therapist for a couple years at Bellin's cancer team in Green Bay. And now I am the clinical coordinator. I just started in February, where I teach a couple classes throughout the years, and then I'm also in charge of the students' clinical rotations.
All right, that's really interesting. I think this is probably maybe a lesser known career field. So I know you have some information
Absolutely.
to take us through. So go ahead and you can walk us through your slides and just let us know when we need to move to the next slide.
All right, you can go to the next slide right away. So a lot of people do not know what radiation therapy is or what radiation therapists do. Even a lot of my friends and family have no idea. But this bottom right picture kind of does a good job of showing what a typical treatment would look like. So just a definition. So what is a radiation therapist? So we are healthcare professionals skilled in the art and science of medical radiation treatment delivery. So the majority of our patients receiving radiation therapy do have cancer. And along with surgery and chemo, radiation therapy offers these patients the best chance to succeed in the fight against their disease. So this picture on the bottom left is what we use to produce radiation. It is called a linear accelerator. And then this picture is just kind of the inside of the machine. It goes a lot more in depth, but just as an intro, how we produce radiation, we have this electron gun here that produces electrons that go through this accelerator waveguide. This waveguide accelerates the particles, and they actually slam into a target. And when they hit the target, it actually creates high energy photons. And these photons are what we then use to destroy the cancer cells. So again, it's a lot more in depth than that, but just so you have an idea of what I'm saying by radiation and how it's produced. So you might be thinking, well, how do you know where to aim? So there's a couple different things we can do. We can do a static X-ray image like the far left. We can take a cone beam, which is just like a mini CT scan. And that's what we use for the majority of our patients. And then on the far right is just like a red light laser system, and that monitors the patient's body surface so we can see if they're moving throughout treatment. So with the combination of these three things, we've been able to really shrink down our target areas and spare a lot of healthy tissue, which has been really important in patient success and minimizing different side effects and whatnot. So if you want to go to the next slide. So just some of the things that we're expected to do. So work closely with other medical professionals as a team to provide quality care for patients undergoing radiation therapy. We have to be able to explain treatment plans to the patient and answer any questions they might have about it. We protect the patients and themselves from improper exposure to radiation, determine the exact location of the area requiring treatment. You need to be able to calibrate and operate the machine in order to treat the patient. Probably the most important thing, we got to be able to monitor the patient to check for unusual reactions to the treatment. So I like to say we're their first line of defense. We see them every single day for treatment, Monday through Friday, not the doctors or the nurses. So it's really important that we pay close attention to detail to make sure we notice these different side effects that pop up so that they get the correct care as soon as possible. And then we keep detailed records of treatment as well. So the different focus areas of radiation therapy. So there's two different areas. So the top left picture is what we call a simulation room. And this is when we first meet the patient. They first come in for treatment, but this is where we bring them in, we make their custom molds. So for example, the top right is a head and neck mask, and then the bottom left is what we call a vac lock. And that particular vac lock was probably used for a prostate patient and pelvis patient. So on this first day, they come in, we make their molds, give them little tattoos, take pictures of their setup, make sure they're nice and immobilized because we don't want them moving throughout treatment. And then this scan is what we then use to actually plan their treatment. And then after this scan, It's about 1 or 2 weeks before they come back for their actual treatment. And that is what the middle picture is the treatment room. So depending on where you work, you'll probably do rotations between the two. At the cancer team, we did about 2-week rotations, and we did that so that the patients that you met in the simulation room, you were able to be out there for their first treatment, just to provide the extra comfort for them. So goals of treatment, there's 2 different types. There's either curative or palliative. Curative is when we're actually trying to cure the disease, and those are the longer treatments, so 20 to 44 treatments. And then palliative is when we're just trying to ease the patient's pain, so that's just 1 to 10 treatments. So the most common cancers, so in females, breast, lung, and colorectal, and then in males, prostate, lung, and colorectal. So as you might guess, we see a lot of breast and prostate cancer patients, especially for radiation therapy. So just some important qualities of a radiation therapist. As I mentioned earlier, it's really important to be detail-oriented, not just to pick up on those different side effects, but we also do measurements down to the millimeter. As I said, it's really important that we get all of our target area and we spare as much healthy tissue as we can. Interpersonal skills, you need to be comfortable assisting patients with both the physical and the emotional stress of a cancer diagnosis and treatment. And a lot of times that ends up being more of the emotional stress. So just a shoulder to lean on, someone to talk to, let their frustrations out on. Technical skills, the equipment we use is really cool and really advanced, but it can be very dangerous if it's not used in the correct way. So you need to be comfortable operating it. Physical stamina, you have to be able to move patients on and off the treatment table and into position for treatment. A lot of times patients are overweight or they're not very steady on their feet, so it's important to be comfortable with that. And then depending on where you work, it can be very fast-paced and some long days working on your feet. So these are just some fun pictures of some of my coworkers, just to kind of show that even though being a radiation therapist isn't always the easiest job in the world, we always try and make it as fun as we can for our patients. The reason for this is we're trying to make their experiences as easy and fun as possible, even though the actual treatment is not. We want them to look forward to coming to see us every single day. And it's really cool. You develop a lot of cool relationships with your patients. And a lot of times when they're done with treatment, they'll bring you treats, order you pizza, write really sweet notes, give you gifts. And a lot of times they're sad to be done with treatment, not for the actual treatment itself, but just for the interaction with all of us. So it's a really special thing to be a part of. So these are just some recent quotes that I got from my old boss. Again, just to show you how much of a difference we can make in these patients' lives. And it's the reason why the majority of us get into this career, is because you do have the potential to change patients' lives and make their journey easier when they're dealing with this awful disease. So pros and cons. So as I just mentioned, making a difference in people's lives is the number one. And then a good salary for not really having to go any additional years of school compared to other careers. It's a great salary. Commonly banker's hours. So a lot of times you only work from 7:30 to 4. You don't work holidays or weekends, and you're not on call unless you work for a big hospital. And as we know, a career in medical field, you usually have to work crazy hours on the weekends and holidays. So it's something really great about this job. And then you're very well respected within your team of professionals. And then cons, the only thing, it is a specialized field, so it leads to a competitive job market. And then compassion fatigue, obviously it is not an easy thing seeing these patients go through this horrible disease. So you just kind of have to be able to take the good with the bad in this job. So education, so there are both associate's degrees and bachelor degree programs for radiation therapy. Bellin College is only one of 2 programs in the state of Wisconsin that offer a bachelor's degree program, and we are the only 3-year program in the state. We're also the only program with a VERT, and that's what this picture on the bottom is. Basically, it's a virtual simulator that allows our students to get ready for clinical before they actually go. It's something we're really excited about. And then radiation therapists just have to be licensed or certified in most states. So how to prepare for a career in healthcare. Volunteering is incredibly important. Obtaining a CNA license will definitely help. And then I think the biggest thing is job shadowing any careers that appeal to you. A lot of times you might have an idea of what a career looks like in your head. And until you see it, you really don't know. It can be completely different than what you thought. So I'm a huge advocate for that. And then knowledge really is power. Ask any questions that you can think of. So this is VERT. I won't go too much into this, but it's just a new piece of technology that we're really excited to get. We really think it'll put our students kind of above the rest. So this is just specific to our program, but this is the first year, the classes that you take. Something that I think is cool about our program is you're already talking about radiation therapy in the first year. And a lot of times in college, the general eds don't really apply to your career at all. And it's something that we thought was really important for us to have. A lot of them apply to your career and to help you succeed in your career. And then second year, all of your radiation therapy classes, and when we use that virtual simulator the most. And then the third year is the clinical rotation, and this is my job to make sure that this goes smoothly for the students and the therapists and the clinics. So it's the last part of the program. You're hands-on with the rad-onc department. So you do rotations with the sim, the treatment, and then also with physics and dosimetry. So once that's done, and you graduate, you just have to pass and take your boards in order to get your credentials. And then like most other healthcare fields, you just have to do continuing education credits every 2 years because the field really is ever changing. It's important to stay on top of those topics. So job outlook. So the employment of therapists is projected to grow 7% from 2019 to 2029, which is faster than the average for all occupations. The reason for this being, as people age, the incidence of cancer does increase. So with the aging population that we have today, the demand of therapists is going to increase, as well as with the advancements in technology that we're having. We're detecting cancer earlier and earlier, so that's also going to increase the demand. And then when I said good pay, the median annual wage was $85,000 last year. Obviously, that depends on where you work, but it really is a great salary for the amount of years you have to go to school. So you might be wondering, okay, now I'm a radiation therapist, what can I do from here? So a lot of clinics have lead therapist positions, so that involves like scheduling, updating policies, procedures, stuff like that. You can have on-the-job training to be a dosimetrist or enter a dosimetry program, and those are the people that actually plan the treatments themselves. You could obtain a master's degree to manage a department or to teach radiation therapy in a licensed program, which is what I'm doing right now. And then just an important thing to remember, a lot of times people think rad techs and radiation therapists are the same. They're actually very, very different, and both require their own schooling. So I believe that is all I have on this PowerPoint. Do you guys have any questions?
I have so many questions. This is fascinating. First of all, that was a great introduction and amount of information because it definitely answered some of the questions I had around like education and what it really is. For the education piece, the fact that Bellin has this 3-year program, it looks like, is that kind of because the students are going, is it essentially year round? They're doing a summer semester as well?
Correct, yep.
Okay, great. And when you talk about the continued education after you pass your boards and become a therapist, is it normal for the employer to pay for those additional credits? Do you have to go find those on your own? How do you usually find those opportunities for continued education?
Yeah, so we have what's called an American Society of Radiologic Technologists. It's like a membership. I think it's like $70 a year, and every 2 years you just have to have 24 credits. So with that membership, you're able to get those credits throughout the year by looking at journals, answering quizzes and tests and stuff like that. So it's not too bad. The employer does not, unfortunately, pay for that usually, but thankfully the cost is not horrible.
Yeah, that doesn't seem outrageous. And, students, I often hear that in a lot of our different professions that we talk about, it really is important to be part of those, state or national organizations that are specific to your career field.
Absolutely.
Okay. Great. So one question I had, is there a danger to you when you're giving treatments? What types of precautions are there to protect the therapist?
Yeah, so we wear radiation badges just to make sure that we're not getting any exposure because we should not. We are not in the room with them while they're getting treatment. When we're in the room, there's no radiation that's happening. It is all on the control console when we're outside the room and you hit the button. So there's really no exposure to us, thankfully.
Yeah, that makes a lot of sense. And students, just a reminder, I want you to enter your questions into the chat if you have any after that awesome presentation. So I'm interested to know what the team, I know it's kind of a team approach to treating the patient. What does that look like? So could you walk us through, if you were a patient, if the start to finish of what it's like to be diagnosed and then go through treatment?
Yeah, so for example, like a breast cancer patient, after their mammo, if they were to see an abnormal finding, they would probably first go through their primary and then they would get referred to an oncologist. There are both medical and radiation oncologists. So for breast patient, they would see both. Most cancer patients would see both. The medical oncologist deals with chemo, the chemo side of things, and then the radiation oncologist, radiation therapy. So from there, they would then meet with the radiation oncologist and the medical oncologist, have a consult, determine the plan of treatment, if they're going to get chemo, if they're going to get radiation therapy, if they're going to get surgery, or a combination of those three. So that's kind of the first step. And then after they were to determine that they were going to have radiation therapy, they would have another kind of consult. And that's when they would come in for that simulation where we would make their custom molds and do the actual planning scan. And then, as I mentioned earlier, the dosimetrist, that scan that we take, the dosimetrists use, along with we have a physicist on site always. So our physicists, our dosimetrists, and then the radiation oncologist, they all work to plan that treatment. And then usually it takes about 1 to 2 weeks before that plan is ready and approved by insurance. And then they'll come in for treatment. And like I said, it goes from Monday through Friday. There's always nurses on staff. So kind of our radiation oncologist team is the therapist, the physicist, the dosimetrist, the nurses, and then we also have cancer coaches or navigators that kind of help these patients because there's so many different moving parts with chemo, surgery, radiation that also help with the process of things.
That's really interesting. I don't think I've been familiar that there would be that role. How does a person end up in that role, the coach role?
Yeah, that's a great question. So I didn't even know it existed either. It's a pretty unique thing. I think they're just starting to develop these roles in radiation oncology and medical oncology. But I think a lot of times people end up being nurses first, and then they end up discovering that this role exists. Because otherwise there's really no way of knowing that that is a career path.
Yeah, there's no college major dealing with that just yet.
No.
The dosimetrist, I was wondering about that as well. And you mentioned that there's additional training. Is that a whole other degree? Is it just continued education or training on the job? How does somebody take that step?
Yeah, so usually you have to be accepted into an dosimetry program for the most part. And that, depending on where you go, can be about 2 years. And depending on where you go through school, it can be on the job training, so you can still work as a radiation therapist at the same time. But a lot of times you just have to go full in on the dosimetry program. It's just like a radiation therapy program for the most part. It's a lot of, you're on the computer, the majority of your job kind of planning these different things.
Oh, that's good to know, because that obviously differs than what.
Yes, you're not working with patients directly.
Preparing the patient and getting the molds ready and doing all that made me wonder, well, first of all, how long does an individual treatment take?
Yeah, great question. So for the most part, the actual treatment itself is really, really quick, only about 2 or 3 minutes. The longest part is setting up the patient, taking their image, matching their images. So when I worked at the cancer team, we had patients in 20-minute time slots to allow for that additional setup. But treatments are actually very, very quick.
Oh, that's good to know. Because the next piece I was wondering was if it's hard to keep patients calm, being, immobilized the way they are. Does that not happen as often, or is that still kind of a thing you have to deal with?
Yeah, it's definitely still a thing, especially with those masks being claustrophobic. It's not comfortable at all. They're very, very tight. So we try and do our best we talk over the intercom to give them updates, but the shorter time frame definitely helps us with that.
Oh, for sure. All right. This is such great information. I'll jump to a question that we have in the chat as I'm looking through mine. One of our students that's coming in from one of our classrooms wants to know, and especially because you're arranging the clinical experiences, do you have any recommendations on how to find a job shadow currently? Do you think that hospitals are allowing that right now, or it's really not happening yet?
Yeah, I don't know if it's quite happening yet, but I'm hoping within the next couple months, places will start to open up a lot more. I know something that I really like about the De Pere schools in the area, they have a class that allows students to job shadow a bunch. I know everyone's not fortunate enough to have that opportunity, but if you can find any connection, I would think that they would start opening that up very soon. Hopefully.
To know. Do you think it's easier maybe to get into a volunteer position right now, because that's a more essential role versus this kind of extra thing that they'd be doing? Would those be available?
Yeah, absolutely. I think a lot of places are looking for volunteers at the moment, just with COVID clinics and stuff like that, vaccine clinics. So just getting your foot in the door through that way, and then you can kind of form those connections to be able to job shadow different things.
Yeah, that's maybe the route to go right now, students. And it's a 2-for-1. Yeah, because you're getting that volunteer experience and then getting to know and make connections and then being able to do some of that. All right. So one of the other things I was wondering was kind of that day-to-day. You mentioned that there is, I think you called it compassion fatigue. Is there a high turnover because of that stress, because you're dealing with cancer patients the majority of the time? What might that look like?
Yeah, there is not actually a high turnover rate. A lot of people end up working as a therapist until they retire because it is an awesome job. Honestly, I think it's a great career. Just with the hours is a big thing, and then the pay too, and then the impact that you have on people's lives. But something that you learn, it was definitely something I struggled with in the beginning with the compassion fatigue, because you do see a lot of not so great things and you lose patients, and it's definitely tough. But patients that make it through and you see a couple months later when they come up for follow-up kind of make it all worth it. And it's something you have to be able to do, is kind of shut your mind off when you leave work, because otherwise it can definitely be overwhelming thinking about those patients.
Yeah, that definitely makes sense.
Something you learn as you go
Yeah.
into your career.
So you had shown some pictures of your teammates. What is like maybe a team? How many people are you working with on a day-to-day basis?
Yeah, so depending on where you work, for example, at the cancer team, we only had one treatment machine. So there's always two therapists at a time at least treating, and then two other therapists in that simulation room. So at the cancer team, we would always have four therapists there every day. But when I worked in Northwestern Memorial down in Chicago, huge hospital, they had like 10 treatment machines. So there's a lot of us there. It all just depends on how many machines the clinic has.
That makes a lot of sense. Well, students, we're wrapping up. We've had such a great amount of information about this career. What do you recommend for students who probably need to set themselves apart a little bit to be getting into this competitive field? What might you be looking for as far as getting into school and having a chance at this program?
Yeah, so I think volunteering is a really big thing. I know that with the times now, the job shadowing is not going to be as easy to come by. But besides this year, that would be something really important to do, is to actual job shadow a radiation therapist. And then just to have like an idea of why you would want to go into this field. Having a strong passion for it is something that we look for. We want you to be passionate about the field, because as we said earlier, the compassion fatigue is a real thing. And if you're not passionate about helping these patients, it can be a very difficult job if you can't see the good in it. But other than that, just kind of taking your classes that you should take, the anatomy and all that stuff, chemistry, physics, but just volunteering, and then just having a strong passion for the field and understanding what exactly, doing a little more research on it, stuff like that.
That's really, really helpful. Well, Morgan, thank you so much for all of the great information that you shared today. It really, I know, opened up my eyes and educated me on what this field is and
Yeah.
what it takes to be successful in it. And so we appreciate your time today. Thank you so much for your time today.
Thanks, guys.